Welcome to Startup Health TV. I'm Logan Plaster with another Health Moonshot update. My guest on today's show is Garima Tripathi, the co-founder and COO of Care24, a company that joined Startup Health in 2019. Care24 has built a digital platform that facilitates in-home nursing care. Launched in Mumbai around 2014, the company has facilitated more than 1 million patient visits. So it's a two-sided marketplace where on one side, families can sign up and post the care needs that they have and look for help. On the other side, nurses can create profiles and look for work, and in many cases, earn more money than they would in the hospital. In our interview, we'll talk about why this area of in-home nursing was ripe for disruption and how Care24 is branching now into work in Delhi and in Bangalore, and there's even a partnership in Japan on the horizon. Stick around.
Crazy.
Well, I'm here today with Garima Tripathi, co-founder and COO of Care24. Garima, thank you so much for taking the time with me on Startup Health today.
Thank you, Logan. Thank you for this opportunity.
So you're innovating in, I just realized that I said Startup Health Today, like that was the name of the show. And it's Startup Health TV. I've never done that before.
It was good, right? Startup Health Today.
Startup Health Today. I was like, that's not the show. That's a critical error. So you're innovating in, among other places, home health, particularly in India. I know you're there in Mumbai. I read that you're the largest home healthcare company in Mumbai. I think you say that on your website. 1 million attendant visits, 1.3 million patient visits. That number is probably higher since you put that on your site. Give me a little bit of a historical perspective. What was senior care like before Care24? What was the landscape into which you entered with your startup?
It's a very, very good question. So we are talking 2014 then, and 2014. I remember like my mom had undergone a hernia surgery in Lucknow in a small town in India. And when she came home, there was nobody. There was no one to check on her, how she's doing her post surgery. And we had to go back to the hospital with her to show her to the doctor. And she was fine, and touch wood, everything was great, but there was nothing that time. Coming to Mumbai and Delhi, there are very fragmented services. It's a very fragmented industry. So you will have local bureaus, what we call nursing bureaus. So if someone needed a nurse at home, they will call these local agencies and they will just send someone without any certificate, without any background check. You don't know if the person coming to your home is actually a nurse or not. So we entered 2014, Vipin and I, he's my co-founder. We were very sure that healthcare has to be a little more accountable. It cannot run like this way. It's about people's life. It's about our parents' life and somebody else's life. So we started with a very simple premise of when we are saying that we are sending a nurse at home, let's send a nurse at home. And we started just by that check. Yeah.
Now that obviously the need was strong, but you had to make a business case. What are the economic drivers around being able to get a certified nurse into the home?
So actually, it makes sense for both the parties, because nurses, when they're working in a hospital, they're very restricted to an 8-hour day shift, and especially nurses who are mothers, and they cannot take leaves, they cannot spend time with their kids or family, or nurses who will get stuck on a night shift. So then they are only working at night. So for nurses also, home healthcare is a lot more flexible and they prefer that. And for a patient, it's actually 40 to 60% cheaper to get a nurse at home than to drive all the way to a hospital and wait there. So the time and money is actually a lot more expensive when you go to a hospital than when you call somebody at.
And are those fees that are paid for by the families as private versus insurance-based? How do you handle it?
Yeah, so in India, actually, the insurance penetration is very low. And government has started Ayushman Bharat, which is covering people below a certain income level for insurance. So they are trying to increase that number, but still that number is not very high. And home care is not covered, so it is private pay. People call an attendant or a nurse at home, the families pay for that.
Got it. Okay. So that was 20, you launched in 2014, 2015?
2015, yeah, yeah, yeah. 2014
And
we started talking, and 2015 we launched our operations.
okay. And what was your kind of general growth trajectory? I mean, obviously it took a bit to get to this 1.3 million patient visits.
So actually, when we launched, within 2 days, we were serving 10 patients. And
So,
like first, yeah, so first was a nurse visit, a diabetic patient who had just undergone a surgery. He wanted a nurse at home because the dressing had to be done 3 times during the day. So he was not going to the hospital 3 times during the day. So we got the nurse, that was our first patient. And then he told in his own building that, oh my, a good nurse will come and do all this at home. So within 2 days, we had 10 patients. Within a month, we made it 25.
mm,
And then from there on, like we introduced technology. I think we raised our seed round within 2, 3 months of launching operations.
oh, wow.
And yeah, that was also 2015. Things were like, going up. The startup scene was really booming that time. And then we raised our series A around, we had the term sheet around August, and we raised it around October. And that's when we introduced a lot of technology, and we jumped basically from 100 to 100 visits per day to 500 visits per day. Like it was technology that made that jump possible for us.
What new technology did you introduce? Because it kind of occurs to me that in this situation, you have the potential for new technology, but then there's also the potential for just delivering on the basics at a large scale, just showing up and having a certified nurse do that wound care or whatever it is. You have sort of the non-technical side that's incredibly valuable, right, at scale. So
Yeah.
where does new technology come in?
So technology is what is Logan making it possible at scale. Because how would you know for 100 patients which 100 nurses will go? Like a human being cannot decide, or you'll have to put at least 30 people to choose 100 nurses to go for 100 patients.
Sure.
So our one of our like one of the best things that we have made in technology is actually our matching engine. It's an algorithmic AI driven matching engine. Based on the patient's requirement, the system will tell you who's the best nurse. The team
Gotcha.
just have to do a customary call to just confirm with the nurse. And then there is a background technology of figuring out which patient should get the care first. Because someone is just getting discharged, needs the nurse before. And while someone is, thinking of taking an ADL attendant, which is like assistance for daily living from day after tomorrow. So the system decides which patient should get the service. The system decides which nurse should go there first. So that was like the first piece of technology. The second one was attendance. I don't know whether 100 nurses are showing up or not. And we tried calling all of them. Like there was a time when we thought like, okay, we have money, let's call. But it's
Okay.
not possible. Like within 15 minutes, how can you make 500 calls?
Yeah.
And everyone needs service. For a patient, we have to understand that a patient wakes up at 6 or 7 a.m. in the morning. If the diaper doesn't get changed at 8 a.m., the patient will be in that dirty diaper for hours.
Mm,
So getting the nurse on time is a matter of dignity for that patient.
yeah. Interesting.
So then,
So you have to automate that communication process. You have to. Are the healthcare providers employed by you, or is this kind of a two-sided marketplace where you allow contractors to get on the site, get a job, et cetera?
yeah, so it is a marketplace, it's a platform, and
Okay.
that has helped us maintain quality and get on scale. Because if you hire people on payroll, and even if they don't perform, the hiring and the firing cycle will take a month.
Yeah.
And the cost will be very high because this is like a distributed market. Like in Mumbai, there are clusters where there may be demand today, but may not be demand tomorrow. And I cannot hire people on my payroll. So we started with a marketplace.
Got it. Got it. No, that makes sense. I mean, obviously, the positive impact for seniors that need this help is strong, but what you're describing is a situation where you're also giving greater flexibility to nurses. So maybe you could speak to the positive impact this could have for the healthcare workers themselves.
Yeah, I mean, we have caregivers coming to our office with boxes of sweets because they had never made this much money in their lives.
Really?
Yeah, because in a hospital, of course, they will never get paid this much. Like hospitals, we pay 30 to 40% more than what a hospital pays them.
Okay.
Uh,
Wow.
and
And they get
it's
the flexibility.
and they get the flexibility. And most important, Logan, for them is actually the traveling time. It's a 12-hour shift in India, unlike in the Western world where it's an hourly care. So people hire, I know like in Scandinavian countries also, people just hire for 2 hours, for 3 hours, for 4 hours. In India, it is a 12-hour care. So someone has to be there from 8 a.m. to 8 p.m. Yeah.
That's every time. That's kind of a standard
Yeah.
shift. So if I'm going to provide home care, I'm going to be in your house for 12 hours. Gotcha. Gotcha.
And kids are buying for their parents, but someone is there for 12 hours, just making sure that they are fine. And it's also like a function of like labor being cheap here.
Got it. Interesting.
And
Yeah.
sorry.
No, I'm just fascinated by the sort of marketplace platform aspect of this because there's just benefits on both sides. I mean, we've seen this with ride sharing. You know, the idea of giving an individual the opportunity to make a little extra money on the side. There's this employment benefit that is sort of wholly separate from the technology. Well, from the advances in the senior care, sort of helping both sides of the equation. Um, you know, let's talk about this past 12 months. Obviously, we had this ramp up in adoption and understanding of telemedicine and at home monitoring. How did that hit Care24 and kind of how did the last 12 months change for you?
I We have been blessed. I have a great team. The team, every member of the team just cares about the patient so much. So we are blessed that way. Of course, the revenues were hit by the pandemic because Mumbai and Delhi, they run on local and metro. Like everyone travels, and I think like in other cities in US as well, there are richer parts of the city and there are not so rich parts of the city. So all the people who are working, they come from not so rich part. They travel all the way to downtown to get
Got it.
jobs. So same. So caregivers could not travel. What we did that we promoted a lot of live-in care to ensure patient safety and caregiver safety,
Got it.
and families were also open to that. So we started doing a lot of like 24-hour live-in care.
Okay.
uh, yeah, and also did a pickup and drop service that the team coordinated with everyone. So we'll pick up the caregiver, drop them at the patient's house with the COVID negative report. um,
Interesting. Interesting.
yeah.
So that was more your way of responding versus leaning into telemedicine or remote health monitoring. What role do those sorts of technologies play in the future of this company?
So it does, like what the tech part that helped us a lot is actually now almost 100% of our caregivers are using an app to
Okay.
do the entire operations, which was not the case pre-pandemic. But the pandemic just forced them to be on the app because there was no way. They could not come to office. They cannot travel if they don't have the app. They have to show the iCard. They have to get the travel route. So was a big change for us. We did start a part of remote monitoring, and we do see that happening with device integration. I think like that will be a big part because a lot of elders can't afford, since it is private pay, they cannot afford a 12-hour care for long. But getting a device in their house and getting a nurse monitoring remotely will be greatly helpful for them.
Yeah. Yeah, that makes sense. That makes sense. So here it is. We're entering Q2 of 2021. What's your forecast for the next year? What are you excited about for Care24 and your growth for the next, let's say, 3 quarters?
So we just launched Bangalore. We are almost live in Chennai as well. So in India, we are expanding,
Okay.
and because of technology, we are able to expand even when there is lockdown in the country, just because of like remote work there. The other thing that happened actually in this journey of 6 years, we built this technology from zero to where it can cater to an agency of 50 patients, as well as it can cater to an agency of like 5,000 patients, 50,000 patients. So we have a Japanese partner now, and we are launching the SaaS piece in Japan.
Hmm.
And that's a part of like Care24, where we have built this SaaS product, which is so good. It's like AWS, that you built it in house and then you realized, oh, it's actually applicable for everyone.
Sure.
So we are excited about actually launching it in other countries now, so that more and more patients can get care through this tech. Like what it does, it just makes the care a lot more reliable and account like accessible to everyone.
And that software that you're potentially licensing to a Japanese company, that's the platform itself. That's the two-sided
Yes.
marketplace. where you can sign up for the care and you can sign up. Okay, so now that you've built it, now the idea is, could we license it? Could we deploy it elsewhere?
Yeah, we are exploring that options in US as well.
Interesting.
Yeah.
Well, one of the things we talk about a lot at Startup Health is the power of leapfrog innovation, developing a technology in a certain environment without the same regulations or the same market forces as somewhere else. You're able to sort of jump over certain hurdles, certain legacy thinking. And I wonder, what you think has been possible in that regard when you compare yourself to potential competitors, whether it's in Japan or the United States. Like, have you been able to sort of jump forward?
So I think like first that it is built by in-house experience. So first-hand experience that we knew that patient wants this. Unlike a software company trying to build a software, here an operations company built a software. So the product understanding was already mature on day one. And then I think that
Why was your understanding of this market so? Why was that a special understanding? I mean, have you worked in this before, or kind of do you bring a special appreciation for senior care?
yeah, I think everyone in the team is very passionate about patients. Like we feel that at that age they need dignity, more care, more love, and whatever it takes to get them that. And we are very close to the caregivers also. Actually, like I think we have done a lot of tech innovations on the caregiver side. Like 80% of our caregiver hiring happens through referral, zero cost. Like we don't spend a single money, and caregivers bring more caregivers just on their own. So that's that. And I think the private pay environment of India, it helped us actually. I think with a lot of insurance regulations, you worry too much whether this will be covered or not, that will be covered or not. So we were able to build the entire piece without worrying about the insurance. And now the system is compliant with both. It can take care of insurance as well as it can take care of private pay.
Gotcha. All right. Well, that's the time that we have, Garima. I love hearing about what you're building with Care24. I mean, it's clear that it comes from a deep passion from you and your team. And it's fascinating that you've built a platform that really could have applicability in Japan and the US in a broad number of environments that not only helps the seniors at home get the care they need, but also gives workplace flexibility, better pay, dignity to nurses. So love that two-sided marketplace, that platform concept. So I'm excited to hear more about what Care24 is going to do in the coming year and beyond.
Thank you. Thank you. Yeah, I mean, this was great for us also. I met Katya in 2019, I think, in March. And that's how we started our connection with Startup Health. Yeah.
Well, we are proud to be supporting you and being a part of this movement in India, in Mumbai, where you are, to bring better care to seniors. So thank you, and I hope you have a great evening.
Thank you, Logan. Have a great day. Thank you so much.
Take care. Be well.
Bye.
A quick word about this show, in case you're new around here. At Startup Health, we believe in broadcasting the stories of health moonshot progress, the stories of the most forward-thinking entrepreneurs in health. If you want more of this good news about healthcare's problem solvers, make sure that you subscribe to our channel, hit that notification button, and follow us on social media at Startup Health.